We're also going to keep talking about emergency situations and what nurses need to know, or other healthcare professionals.
Yes.
With working with transgender folks in emergency situations.
Yes. So a great question, because a lot of times people are like, okay, using pronouns and asking for them is nice, but what if my patient is dying? What if this is an emergency and we have precious seconds to do things? What do I do? And the ABCs are the same for trans people as they are for any people, marginalized or otherwise. So if you have a patient that has acute needs, you're going to address those first before you deal with the other things. Now, there are some specific areas where you might need the answer to this question. If there are some pieces of anatomy that we need to know will be there or not. Previously, we discussed urology. If you're in urology, you need to know if your patient has a prostate. These are questions that are okay to ask because you need to know. In an emergency, if you have time to explain why you're asking, I think that's a very good idea, but it's all about patient safety. If this isn't something that you would normally dig into with a cis person, in an emergency, there's really not necessarily a need to dig into it with a trans person. There is one caveat I'm going to throw in there, is the importance of understanding that for a lot of trans people, there is a huge amount of fear in engaging with emergency services. Historically, there are many examples of trans people in the United States who, before legalities changed, died while EMS watched them because EMS realized they were trans and refused to provide care. And so it's really important to realize that for a lot of trans people, when we engage with emergency medicine services, those memories, those stories come very much to the forefront of our minds. And so realizing that your patient has to balance oftentimes their fear of seeing you versus their health needs. So making sure that you're working hard to provide kind, affirming care is really important.